In this abstract, so we are looking at a phase 3 study where we randomized adjuvant pembrolizumab in resected high-risk melanoma and compared that to standard of care at the time, which was high-dose Ipilimumab or high-dose Interferon. That was patient-provider choice, and looked at primary endpoints of recurrence-free survival and overall survival. And in this abstract, what we found was that there is a statistically significant difference in recurrence-free survival with a hazard ratio of 0.74. And if you look at overall survival, there is a numeric difference, but it is not statistically significant. So no significance to an overall survival difference. That hazard ratio is 0.84, but again, not different, at least if you look at the stats for it. There are clinical implications in the short term. So I think in the short term, so in this study, the analysis was done 3.5 years after the last patient was randomized. So at least in the short term, 3 to 5 years, we're not seeing an overall survival difference with adjuvant immunotherapy. Now, does that mean that we won't see a difference in the long term? We don't know. Or maybe with overall survival, the way these studies are designed, we might not be able to see that difference because then there are other subsequent therapies that are changing the ultimate overall survival outcome. So we'll need more time and more data to really figure that out. I think, though, clinically, you might be able to say, for a patient who's very hesitant, or there's some clinical situation where the practitioner is hesitant, you could probably say that in the short term, there won't be an overall survival difference between going with or without adjuvant immunotherapy.